my fellow beings, my name is Amanda, and today we're going to be talking about medical trauma. And this is a subject that a lot of people don't talk about, so I feel that we need to discuss it more because it happens more often than people think. And so I believe that we need to discuss it and make it more common in the vernacular of those around us so that people will realize that it does actually happen. So I need people to realize that if someone comes to you and tells you that they have suffered from medical trauma, that they aren't making it up, that it is a real thing. So the first thing I want everybody to understand is that the term medical trauma can encompass so much. And so people can experience medical trauma in so many different ways. It doesn't have to just be one prescribed way to experience it. And the other thing that I want people to understand is that it can affect anyone at any time. So it doesn't have to be a certain individual. So even if you haven't experienced it right now, there could be a time that you do experience it, which I hope you never do. If you've never experienced medical trauma, I very much hope that it never happens to you. One thing to remember is that medical trauma is subjective. So no one can tell you how your experience has affected you because they are not you. And you can't tell another person how they have experienced it because you are not them. So it is very subjective, and it is something that is very personal to each individual. So one of the main reasons why medical trauma exists is because medical professionals are trained to deal with physical symptoms. And so when you come in and you're having a really hard time dealing with your physical symptoms, or something's happening in that space that you don't particularly like, the medical professional may not be trained to deal with your emotions in that situation. So after you get a medical treatment, you may just be sent home and not get any kind of therapy or anything to help you deal with the situation that happened at that time. So a way to describe what's going on with medical trauma is that your brain is recording everything that's going on. So while the situation is happening, it is recording everything that it sees, everything that it smells, everything that it's tasting, everything. And you may forget what's going on later on, but your brain does not forget. So later on, when that experience happens again, and it doesn't even have to be the exact situation again, it can be just a smell or the sight of something. It could be something very benign, like the smell of hand sanitizer can trigger off medical trauma. And the thing is that your brain, when you're going through this situation, is telling you there's danger, I need to fight or flight or freeze. And so when your body is experiencing bright lights or the smell of disinfectant or linoleum floors, it could be anything, can trigger the remembrance of a medical trauma that happened to you, and you can go into that fight or flight mode and you get really anxious and you need to leave. So places that you could experience things like this are doctor's offices, obviously, dentist offices, being touched by someone, smells can trigger it. For me, my trauma comes back when I smell a particular hand sanitizer. When I smell that hand sanitizer, it instantly takes me back and I go into fight or flight, and I get really nervous and anxious, and I can go into a panic attack just by smelling this particular hand sanitizer. It's not all hand sanitizer, it's a particular one that happened when I went to the ER. And when you're having a traumatic event, when you're having a recollection of what happened to you, you can have feelings of numbness, disassociation, you could have a panic attack, you can start using substances inappropriately, it can cause sleep problems, all kinds of things. It can cause a myriad of symptoms when it comes to reliving that event. And the thing is that when it comes to medical trauma, it can be because of negligence. That is definitely a possibility. I know for me, when I was in Europe and I had that event that I talked about earlier, you can find them in the iCards up above. I know for me, that was negligence. They really didn't treat me very well. Sometimes it could just be because they don't understand that there is an emotional part that needs to be addressed with this procedure that's happening. Or it could be caused by something that no one could have prevented. It just happened. Like for me, when I was in the ER last year, I know for me, nothing anyone could have done could have prevented what happened to me. Yes, it's true, I probably wouldn't have had as bad of a reaction to it if they would have let my husband in, but because of COVID, they wouldn't let him in, so I was by myself. So that could have helped if he was there. But for the most part, the things that happened, it just ended up being traumatizing, and I don't understand why. Some things that can cause medical trauma is maybe a medical professional ignored you, or they didn't take your symptoms seriously. Maybe you went into surgery and your wishes weren't respected, or you were separated from your primary support person, which is what happened to me. I was separated from the person that would stand up for me, and that is what caused my trauma, because I didn't feel like I had a voice, and the person that usually would speak for me wasn't allowed in. So carrying medical trauma can be the same as any other trauma, and it can leave you in the same place, and it can help, and it can make it harder for you to manage symptoms and make life harder in general. So some things to help you not to have medical trauma are things such as making sure that even if the procedure is planned and you are anticipating a procedure to happen, make sure that you bring an ally with you. Allies can be amazing sources of reassurance when you are in a medical setting, because they can make sure that you are spoken for, that the needs that you have are there. And even if you don't have someone particular, you can ask the hospital, and there are people that their entire job is to make sure that they speak for the patient. So find someone to be an ally for you. And even if you believe that you can speak for yourself the entire time and that you're a good ally for yourself, it is important to bring someone with you just in case, because that can make all the difference when it comes to medical trauma. And they could be a person that knows you really well, that they can speak for you in a time of crisis. Because sometimes when you're in a situation that you are overwhelmed by everything that's going on, you can't seem to speak. For me, I ended up getting tongue-tied and not being able to speak. I was also in excruciating pain, so trying to think through my trauma or trying to think through this experience was almost impossible. And so I ended up just opening up my medical ID on my phone and just handing it to the nurse, because I couldn't speak for myself. And so if I would have had someone there that could speak for me, answer questions for me, that knew about my condition, I think that would have made the world of difference. The one thing that I want everybody to understand is that living with medical trauma can leave you feeling angry, can leave you feeling shame, can leave you feeling tired and foggy, disassociated, and can bring on a lot of intense emotions. But there is help for those who have suffered through medical trauma. There are therapists out there that know exactly how to deal with your kind of trauma, and they can help you work through those things. I know for me, my therapist has helped me tremendously with the trauma that I went through. And now, because of talking with her, I can look back on the trauma that happened to me in Europe, and I can find humor in it, whereas most people can't get to that point. But it is possible to get to that point. We're still working on the most recent trauma that I went through. It hasn't become funny yet, and I'm hoping that someday I will be able to look back on it and find the humor in it, because I like to find the humor in everything. But right now we're not at that point yet. But I know that for me it is possible, because I can look back on the trauma that happened to me in Europe and find the humor in it now. But I do suggest trying to find a therapist for anyone that is suffering through medical trauma. Please remember that you are not alone. There are so many people out there that have suffered through medical trauma, and you have people that can rally with you and tell you that you are not alone. And know that no matter what you have gone through, there are those of us who can come to your aid and help you to feel okay about your situation. It can be scary, it can be intensely emotional, but you can get through this, and I believe that you can. I hope that you learned something from this video and that you learned that it is a real thing that has happened to people, and to have sympathy and empathy for those who have suffered through medical trauma. If you did enjoy this video and you learned something new, please consider subscribing and click the like button if you did enjoy this video. Remember to be kind. Kindness is free, so give it out to everyone, including yourself. And I'll see you next time. Bye.